downtown Johannesburg, Crew Street, Marshalltown, and this is our iScript clinic. This is one of a franchise of primary care clinics, which is part of our integrated system and coordinates to refer patients upstream to our advanced centers and to our specialized hospitals.
The partnership is between three different healthcare facilities. The first one is primary healthcare, and primary healthcare is going to be served by iScript.health. The second one is going to be the advanced medical center, where we have the specialist. And the last one is going to be the hospital, where patients are admitted for complicated cases and they spend day in hospital. So this is the doctor's rooms, and this is where we get to see the patients. After they've come from the nursing station, this is the next stop. By the time they get here, the doctor already knows from the computer that the patient is there because they can see it on the system. They open the record and they're able to see the vital signs coming from the nurse. And by the time they get here, they already know where or what the presenting complaint is and what the vital signs look like. That's where now he takes over by taking the clinical history, doing the physical examination, and coming up with a treatment plan. And in the procedure room, it's the place where we do most of the small procedures. Again, like I mentioned, we don't do major operations here. But if you need something like stitching, someone needs to get fluids as an emergency, for antenatal care, you can get your ultrasound sonar done here. This is where we do all the procedures. So this is a dispensing practice. And the idea is to make sure that by the time the patient is leaving, they have their medication with them as a management plan or a treatment plan. In the dispensary, we store all the medication that the patient needs, including vaccines. We've got fridges here for vaccines and any other cold chain item. The patient comes here with a doctor, gets the medicines that they need, and that means that the whole treatment plan now is finished and they can go home with some medication to take.
I think our first big advantage over the market is that we have very good infrastructure and the patient flow and management is very well planned. The 2 points that we've agreed upon that we attend to immediately in every patient is distress and pain.
The immediacy of addressing the patient's pain, the patient's needs, and crafting the outcome very quickly because of the diagnostic information we have is something which is unparalleled in this primary and intermediate advanced healthcare system.
What is for me particularly important is the fact that you can have 4 or 5 patients simultaneously because you're actually almost doing a mini ward round and telling the sister, on patient 1, I want the following investigations. Patient 2, let's send the patient for x-rays and the following bloods. Patient 3, I want to take the patient into the sonar room. I just want to have a look at the depth of this assay, mass or abscess, and then we'll deal with that. So the patients feel that they are getting much faster, much quicker and faster attention and processing. I think that's very important too.
As you can see in the background here, it's a hospital still under construction. This is the Johannesburg Specialized Surgical Hospital, which will open in October this year. It has 300 surgical beds. Now, this is a special world-class facility. It will have all the top specialists and the specialities. And this will serve not only South Africa, but the whole continent. We're also able to do investigations, sophisticated investigations, radiological, laboratory, of all different kinds of diseases and the full spectrum of surgical diseases. This is a hospital which is a one of its kind.
Our vision also to produce super hospitals with online 24-hour-a-day connectivity between them and Pennsylvania, Oxford, Stanford, Harvard, etc. And this will all make a huge impact on the quality of care ultimately delivered.
What I'd like to share about our common vision is that we would want to consolidate our professional skills from basic care, nursing care, occupational therapy, general specialty care, and transfer these skills across the continent. And in doing so, we even would arrange for physical transfer of specialists and healthcare workers between the different countries on the continent to mentor their colleagues, to train, and also to learn about the local knowledge, practices, and attitudes in those countries.